Imagine for a second finding out that you've had a heart attack. Just over a year ago, I went to the doctor thinking it was going to be a routine checkup. No symptoms, no problems. At least that's what I thought. What I found out? Let's just say it left me questioning everything. They told me that my heart was overworking itself, that 15% of the time it was beating when it wasn't supposed to. At first I brushed it off. I mean, I work out every day. I have to be healthy, right? But then they said these words to me that hit me harder than any workout ever could.
There are some signs that might indicate you had a previous heart attack at some point.
A heart attack? Me? The guy who trains, eats clean, lives for fitness? It didn't make any sense. And that's where this journey all started. One question after another. Fast forward a while, and now I found myself awake in the middle of a surgery with a catheter inside my heart, trying really hard not to freak out. Oh, and the fun fact, burning the inside of your heart, yeah, you feel it. Obviously, I survived the surgery, but did it work? Will my heart function like it should? And can I continue to work out?
How you doing?
I'm fine. I didn't have heart surgery. You know what I mean?
So as you know, this is my first workout in a week.
Yeah. What do you want? What do you want to do?
Yeah, I mean, I think I want to get my blood pumping and just see how my heart feels. Some weightlifting, one, because I haven't lifted anything. A machine.
Oh, look, there's Billy Robs.
What's up, buddy? How you doing? Good. How are you? Good.
Look how you're upright, and I'm like, oh my gosh, what the hell?
I feel like I want to get a little bit of a blood pump while also a little bit of weightlifting and just get some endorphins going. So what I think we should do is 15 cal row, 10 deadlifts, 15 wall ball, AMRAP for 12 minutes. Good luck, my boys.
This is the moment I've been waiting for and dreading. The first time I've really pushed my heart since the surgery. Every beat feels heavier, every breath more deliberate. Is it working the way it's supposed to? Or am I about to find out that something's still wrong? I wasn't always this worried. In fact, I never even knew I had a problem until I decided to see a doctor. So let me tell you how it all started. So in the fall of 2023, I went and saw a new doctor. It was a men's health clinic, just as a routine checkup, just kind of see if I could do something with my biomarkers and blood work. Right away, the doctor said that he thought that I had an irregular heartbeat.
And it sounded like what I have diagnosed before in the past, which would be atrial fibrillation.
Atrial fibrillation is a very common, rapid, and disorganized electrical activity of the top portion of the heart, the atria.
I've never heard that before. I've been active my whole life. I've been in athletics. I played college football. I've done CrossFit. I've done a lot of things to keep my health in check.
What it sounds like, normally you hear a lup up, lup up, lup up. When I listened to your heart, it was more lup up, lup up, just very irregular. And that always signals a response in my brain, like, okay, this is not normal. Generally speaking, when I hear that irregular heart rate, I think of AFib, but I want to make sure it's nothing else, so we do an EKG. So basically it creates sort of a three-dimensional projection of the electrical activity of your heart.
Atrial fibrillation can lead to stroke, heart failure, blood clots, and heart attack.
It's fairly easy to treat, and we want to treat it because it can lend to different comorbidities.
He recommended that I wear a Holter monitor. That kind of takes a snapshot of what your heart is doing over the course of many days instead of just like listening to it right in the moment.
But based on what we're seeing here, we're seeing a lot of what we call PACs, premature atrial contractions.
Which is just basically extra heartbeats in the top chamber of your heart. Kind of blown away by this. Like, how have I gone my whole life with never detecting this? Like, what could have caused this? Is this a big deal? Can I live with this?
They're actually pretty normal, but the frequency that you had yours was atypical. I haven't seen it before. And that's why it sounded like AFib, because usually you hear like one premature atrial contraction here, after a few seconds, another one later, and so on and so forth. Yours were pretty regular. So when I was listening to you, it just sounded like AFib. So this was kind of the start of our journey.
After being diagnosed with PACs, I still didn't feel any of the symptoms. It wasn't impacting my day-to-day, or so I thought. Curious, I started analyzing my Whoop data, and I saw a glaring pattern. I wasn't recovering. I've been in the red for the past 3 days. I'm gonna just attribute it to the traveling. My sleep was light. Your sleep debt rose to 2 hours and 8 minutes. And REM was almost non-existent. Had this been a warning sign all along? Determined to get answers, my next step was an echocardiogram.
So an echocardiogram is sort of like an ultrasound of your heart. It's looking at the pumping action of your heart. The provider doing the echocardiogram will put like a probe on your chest, and then you can see on the screen what the wall motion and what your valves are doing. When we looked at your echocardiogram, the ejection fraction was low.
Ejection fraction is a measurement used to assess how well your heart is pumping blood.
A normal ejection fraction is around 50 to 70%.
And I was in like the mid to low 40s. So now it was a little bit more of a concern.
We then sent you to another cardiologist, probably one of the best cardiologists in the Valley, Dr. Scott Hackey. And that's when we came up with a different hypothesis. Maybe this reduced ejection fraction, meaning that your heart's not pumping as efficiently, might be related to the extra strain on your heart from the PACs. What were those PACs from? We don't know, to this day.
Well, we should probably put you on a prescription, a beta blocker, that will help lower your heart rate. I don't know if it could have been too much caffeine or stimulants or something like that could have thrown it out.
We do know that respiratory viruses can cause cardiomyopathy. Cardiomyopathies can cause arrhythmias. There were some incidences of the GOWOD vaccine causing cardiomyopathy. I've seen a lot more younger patients have AFib. Generally, it's associated with hypertension, obesity, type 2 diabetes. These guys weren't overweight, weren't hypertensive, they're actually really healthy, and to get this new onset AFib is unusual. I think there is a possibility that the vaccine might have contributed to some of the cardiomyopathy, because we know the virus did. So we don't know for a certainty, but we do know that there have been a lot of new cases of cardiomyopathy associated with the virus itself, the COVID virus itself, and with the vaccine.
So after getting the results of the echocardiogram, he said the next thing I should do is get a stress test.
A stress test is a diagnostic procedure used to evaluate how well your heart works during physical activity. It can reveal potential problems with blood flow, heart rhythm, or overall heart function that might not be noticeable at rest.
I imagined a stress test is I'm gonna run on a treadmill and they're gonna measure what my heart does when it's under stress. I show up at the hospital, they tell me to lay down in a bed, and then they inject you with some medicine that puts your heart under stress. And you just start to feel like, oh man, it feels like you have pressure and it feels like somebody's sitting on your chest.
When the study was read, it did indicate that there was some ischemia. That was concerning for you because when you called to get the result, the nurse said,
everything looks normal, heart rate and the heart function looks to be stable. And I'm like, great, we did detect your previous heart attack.
And you're like, oh really? When did I have that heart attack?
No problem, just having a heart attack.
Like, I've never had a heart attack. You think I would know if you had a heart attack, and they're like, sometimes people don't know they have had heart attacks, and the data suggests that you have had a heart attack.
Well, what do I need to do? Do I need to go into the ER right now? And I'm sure a lot of things were crossing your mind at the time.
So now I'm starting to get really worried, okay? Because I'm like, I thought this was just a few extra heartbeats, something I could live with. Now I might have had a heart attack. Well, what do I gotta do now? And they said, you need to get an MRI on your heart.
A cardiac MRI provides a comprehensive view of the heart's structure, function, and blood flow.
Anxious to find out the results, I finally get a call from Hacking. We start talking. I'm like, so did I have a heart attack? No, you did not have a heart attack. And I was like, oh, thank God.
So clearly that was, a false positive that you had a ischemic issue ruled out by the MRI that you didn't have an ischemic problem. Your blood work did not indicate any suspicion of coronary artery disease. Your lipid panel was beautiful. Your lipoprotein A was great. You know, no excessive concerns there.
There's nothing wrong with the structure of your heart. It's just an electrical issue. I'm like, okay, so what are my options? And he's like, you can stay on this medication that you've been on, and we can monitor your heart and see how it reacts over the course of a few months. The other option is to get an ablation.
They take a catheter, they place it in your femoral vein, work it all the way up to your heart, to the atrium of your heart, and they find where the source of the electrical activity is, and they burn it.
Well, I don't want to do that. Like, that sounds like a terrible option, like heart surgery. Like, I don't want to do that. I'll just stay on the medication and see how it responds. I go about living my life thinking I have a heart condition now, even though that I've been healthy my whole life and never had any concern about this. But now it's starting to affect how I approach a lot of things. When I was getting my hair transplant in Colombia, they hooked me up to all these markers to like monitor my vitals, and they kept going like, "Will you do this surgery on this guy? Like, it looks like his heart is all over the place."
Some patients have some alterations of the electrical activity of the heart, and that's a risk for some medications, you know.
If we're gonna sedate him and do this big procedure, it seems a little bit out of the norm. And I had to explain to them, no, I have this condition called PACs. PAC? Do you know what PACs? And then they're like, oh, okay. And then like, it wasn't just showing up in the tests I did here. I went to do something there, and it was not something that was just gonna go away on its own.
From what they saw in there, they're offering another way to sedate him and to keep him sedated that is a much lower risk to the situation that he has.
You are almost not able to get the hair transplant as a result of that.
It started to become clear to me that an untreated heart condition and an ineffective heart could lead to more robust problems down the road. Now I'm weighing my options: stay on medication for the rest of your life and have it affect how your heart works, kind of like a Band-Aid, or go get this procedure where they can actually fix it for good, supposedly. I reached out to people on social media. Has anybody gotten ablation before? Get a ton of answers. Vast majority of them are all positive. I think I'm gonna do this, even though it seems spooky, it seems scary, heart surgery.
It says I'm an AFib back there. You can see how not evenly spaced those are. Anyways, going into surgery.
About to get an upgrade.
Yeah.
Next thing I remember is I'm waking up, I feel something very uncomfortable down here near my hip, and I start tugging at this thing, because I've completely forgot at this point that I'm in surgery. Anesthesiologist comes over, he's like, hey, we had to bring you out. We couldn't find the extra heartbeats while you were under. So now we're gonna try and keep you awake to see if those extra beats show up. And now it's all like, oh yeah, I'm in surgery. And I'm all hooked up to these machines, and I can see a monitor that has like a 3D mapping of my heart. This giant machine that's down over me. My heart rate is racing. It's like, it feels like I'm like at a max heart rate. And I'm like, why is my heart beating so much? And he's like, well, we're trying to detect the beats. And I was like, man, whew, this is intense. I wasn't expecting to be awake for any of this. The doctor comes over and she's like, hey, so those heartbeats just showed back up. If you're okay with it, I'm gonna start ablating them while you're awake. Well, this is what we're here for. I'm not wanting to go into another surgery. If we're gonna get this thing done, let's just do it, you know? And she was like, hey. And I could feel every single time that they were burning the inside of my heart, and I would just be like, oh, and then it would stop. And I'd look over on the monitor and a little mark would show up where they burned. Oh, another one. And this just went on for like what felt like an eternity. One, I was just super nervous to be awake and like brought out of the deepest sleep to then be in this reality. I'm just getting burned and burned. Okay, I think we got it all. And I was like, great, can you put me back to sleep, please?
Made it out of surgery to was a little bit of a rocky road. If you look at this monitor, you can see how evenly spaced they are on that top green bar.
It's just perfect.
Seems like this all worked. Thank God. Just gotta lay here for another couple hours, and then I'm able to sit up and then hopefully go home. And then about a week without working out, taking it easy, no lifting. But I think we good.
As I approached the end of the workout, I couldn't help but feel a sense of relief. My heart withstood its first real test back. Strong, steady, and ready for more. It's a testament to my baseline of fitness and one of the main reasons why this hadn't become something much worse.
That was the hardest fitness has been in a long time.
No malfunctions. Hey, Shoppe, you crushed it.
Thanks, man.
Because I've been so active my whole life has probably kept my heart in a much better situation than if I was immobile or sitting at a desk all day. That could have probably been into AFib and then progressed more into like heart failure.
Your current health status helped you through this whole process. Improved your ability to recover, to tolerate the procedure itself.
Makes me feel so appreciative to be able to get back into here and do this.
Maintain your fitness, eat healthy. However, on that same note, go get checked out periodically. It's important because there are things that you can't control with lifestyle modification.
So the biggest thing that I've noticed since getting the ablation when looking at my Whoop data is my restorative sleep has like gone through the roof. Prior to getting this done, I was getting like almost no REM sleep or even deep sleep. Since then, it's gone up 313%. So a giant improvement in a small window of time, but it wasn't always that clear because when I would look at my data prior to getting the operation, it was really hard to make sense of it all. And that's kind of what like led me to going and seeing Dr. Joe. And he was the one that led me down this path to getting my heart looked at, talking to doctors, and eventually coming out the other side. And the data kind of speaks for itself. If you've been following the show for a while now, you might have noticed that I've tried a variety of different measures to help improve my sleep and recovery. In the fall of 2023, I started taping my mouth shut at night, thinking mouth breathing was the issue. I even did a sleep study to rule out sleep apnea. Rewinding further to early 2022, I had a nose surgery to fix a deviated septum, hoping that better airflow would improve my sleep. How do I look? But despite all these efforts, my recovery stayed low and it seemed like something deeper was off. Knowing now that my heart could have been the underlying issue all along, I reached out to Whoop's data science team to see if they could identify when all this could have began. They analyzed 6 years of my data and found something alarming. My resting heart rate had noticeably changed in the fall of 2021 and only worsened over the next 3 years. The standard deviation of my heart rate increased from 8 BPM and my average resting heart rate climbed by 4 BPM. This was the first real clue that something might have happened at the end of 2021 that threw my heart out of rhythm. Fast forward to now, and since the ablation, my Whoop is showing nothing but yellow and green recoveries in February, something I've never seen before. Compare that to December, where I had 9 red days. Maybe this is the proof that I was looking for. Maybe my heart was the issue all along, and while all these other health changes were good practices, they didn't fix the underlying problem. This did. Keep in mind, Whoop isn't a medical device, and I'm drawing my own conclusions from my data. So if there's any of you out there that would like to track your health with Whoop like I have, there's a link in the description down below that comes with a free month subscription to the platform and a free band. Luckily enough, I went and saw a doctor that listened to my heart, thought that it sounded irregular, and I was able to go attack that problem and nip it in the butt early than having it show up when I'm 50, 60, and now it's like, oh, this is actually a very big problem because your heart's been overworking itself for years and now it's just not strong enough to pump the right amount of blood out of it. It's like my body's finally able to recover the way it's supposed to. Taking care of yourself physically and mentally isn't just a choice. It's an investment in your future. So get moving, stay curious, and don't ignore the signs your body is giving you, because sometimes the biggest battles start within.